Hey, Dr. Lindsay and Wendy here. This is a little video on a 2-year update on a medical doctor on whom we lowered his hairline about 1.5 inches, right?
Yes.
And he's a guy that's roughly my age, and he does research on anti-aging treatments. And it works because he looks pretty young.
He looks young, yes.
In fact, he sold us on buying a bunch of goofy vitamins that
they're not goofy, they work.
Well, it didn't slow me down from getting gray hair. But in any case, here he is before, and then here's our hairline plan, and then here's the end of the case. You packed him in there really good, right?
Yes.
The trouble that he has is he's got very fine hairs, and just like trees, he's got skinny trees. It takes a lot of skinny trees to cover a grassy field, and so we pack him in as tight as we could get those roots together. And then he didn't show up for 23 months until he walked in a couple days ago.
Yes.
And he looks really good. He looks unremarkable. So take a look at this little short video. Okay, so we're here with this researcher who, on whom we, you just say that. We're here with this researcher that we did almost 2 years ago. And I'm looking back, he's got a really short haircut. And so I'd kind of forgotten his story. That scar's pretty doggone good. And I look and I see a bunch of little FUE marks. And I brought it up to you and I said, I forgot you had FUE, and you just commented it didn't really work, right? You don't have to say who did it.
That's correct, yeah.
But the problem is with those skinny hairs, there's just not enough meat around the root for much of the FUE to work. Now, I won't show your face. Turn back around. And I'll put a picture of your before. This is you. And you got fine hairs, but that's pretty good, right, man.
Yes.
Good.
Yeah.
Is that halfway up front with you when I worked on it?
Halfway up front.
I didn't give you a bunch of nonsense. I was reasonably up front with
you. Yeah, absolutely.
I do not have your face on this. So
yeah.
All right. What do you think, Wendy?
Well, I like it. He's happy too. Yeah. Like, very happy.
The trouble is that, as I've posted many times, hair can be like sex and money, and you always want more. So what's he want? He wants his hairline.
He wants to lower it.
Lower
and
it a little bit more.
We're going to do it.
So I think we're going to do a little case in the next couple of months where we drop his hairline down to about 1 centimeter. You can't go too low.
What's a centimeter?
1/2 inch. And you can't go too low, particularly on dude my age, because then you would look unnatural. The best hair transplants are hair transplants that just look like normal hair, right?
Yeah, when he came in, I thought we were going to start, because he's starting to thin back here. And I thought, we're just going to go and do back for the back. But no, he wants his front. And at the end of the day is...
Yeah, when you're when you're 50-something and you're comfortable with a little bald spot in your crown, well, by all means, spend all your hair how you want to.
Yes, and that's the thing. You could say, I understand when you tell a young kid, save your hair
for the future.
For the future, and somebody like him, I mean...
He and I are no spring chickens, right?
You're no spring chicken?
Yes. So if we can help you, please give Wendy or me a call. Thanks.